here with Dr. Sohail Gandhi and Dr. David Jacobs. We are here representing the Coalition of Ontario Doctors. We represent over 19,000 family doctors and specialists from Concerned Ontario Doctors, Doctors Ontario, and 8 sections of the Ontario Medical Association. We are here today because we have grave concerns over the tentative physician services agreement presented to Ontario's physicians on July the 11th, 2016. Healthcare is the one provincial mandate that impacts every single citizen in this province. Yet the Ontario Liberal government continues to make reckless cuts to healthcare, cuts that directly impact patient care. Since January 2015, nearly $1 billion have been cut from the services that physicians provide. The results have been utterly devastating. With nearly 1 million patients without a family doctor, patients are flooding ERs and hospitals are near or at capacity. Surgeries are being canceled and specialist wait lists are growing to 2 to 4 years. Struggling to stay afloat, more and more physicians are facing clinic closures and are being forced to leave the province. Our healthcare system is on the brink of needing life support. Despite this dire state, the Ontario Liberals have shown absolutely no commitment to begin to address this crisis. And instead of offering to work collaboratively to rebuild our healthcare system, this Liberal government is offering further cuts. Over the next 4 years, the Liberals are willing to fund only 2.5% of growth in patient services. According to the Financial Accountability Officer's report, they must fund a minimum of 3.1% to maintain our bare standard. They must fund 5.2% to maintain the status quo, and in past years, this increase has gone as high as 7%. This tentative physicians agreement is all smoke and mirrors. Cuts disguised as increases with absolutely no commitment from Wynn's government to increase funding to healthcare in the coming years to account for inflation, population growth, or the upcoming silver tsunami of baby boomers who will require more complex care. Even more alarming is that the little details have been provided in this contract. This 4-year, $50 billion healthcare portfolio is merely 6 pages. It leaves even more unanswered questions as the OMA endorses doctors essentially sign a blank slate. The OMA president, Dr. Virginia Wally, recently shared that the OMA Negotiation Committee co-chairs, Dr. Scott Wooder and Dr. Pierre Bonin, were involved in the initial mediation arbitration framework talks with the Ministry of Health. More physicians have recently come forth to share how this 6-page contract was drafted in nearly 10 days, bypassing all 3 critical safeguards. First, the mandate from the OMA Council to not resume negotiations until binding arbitration was achieved was utterly disregarded by the individuals who were negotiating. Then, both the Negotiations Committee and the Negotiation Advisory Committee were not consulted or actively involved in the drafting of this agreement. These committees were merely presented a completed contract prior to presentation to the OMA board. This is the first time in the history of Canadian Medicare that such critical breaches in due process have occurred and leave Ontario's physicians with more questions than answers. We are deeply concerned that the OMA is rushing a vote in merely 2 weeks of announcing this surprise contract. Especially worrisome is that the OMA is telling physicians that a no vote will equate to further cuts rather than a return to negotiations. If this is true, the Ministry of Health is not bargaining in good faith. If this is the case, then this proposed contract is just another unilateral cut in a series of endless unilateral cuts that further undermine patient care. I'll say it again. This contract is another unilateral cut. This contract will change the landscape of Ontario's healthcare system forever and will impact the quality of care every single Ontarian actually receives. All Ontarians, both as patients and taxpayers, have a deeply vested interest in Ontario's healthcare, and we should all be asking why the Ministry of Health and the OMA representatives secretly drafted a 4-year, $50 billion vaguely worded agreement behind closed doors without any regard for due process. The future of our healthcare depends on it. Ontario's doctors refuse to aid the Liberal government in their dismantling of our healthcare system. The Coalition of Ontario's Doctors is calling for a public inquiry into the negotiation process between the OMA and the Ministry of Health. We demand transparency and due process. We demand care, not cuts. The care of our patients, the care of our patients is at stake.
Hi, thanks, Kulvinder. That was very passionate. Good morning. My name is Dr. David Jacobs. I've been a radiologist since 2002. I work in Toronto as well as up in Northern Ontario. I'm on the executive of the Ontario Association of Radiologists. I am the chair of diagnostic imaging for the Ontario Medical Association, and I represent all of the radiologists in Ontario. But most importantly, for the issue at hand, I'm a member of the OMA Negotiations Advisory Committee. For the last several years, as you've heard, the Ministry of Health has been at war with Ontario's doctors. The system is buckling under the pressure. Our CT scan and MR scanners sit idle. Our surgical and endoscopy suites sit idle due to lack of funding. We have new orthopedic surgeons who can't even practice because they are not given the OR time to practice, and the operating rooms sit idle. Our wait times are going through the roof. You can wait over 6 months to get an MRI. You can wait, as a cancer patient, I found out yesterday at one of our oncology hospitals, you can wait 9 weeks for a cancer scan, which should be done within 2 weeks, according to our guidelines. It's really quite concerning. If you want a hip replacement, you're going to wait a good long time. And those wait times are only going to get worse. What's the government's response to all of this? More cuts and a bloated healthcare bureaucracy. To quote Oscar Wilde, the healthcare bureaucracy continues to expand to meet the needs of the expanding bureaucracy. It's absolute madness. So how does this relate to the Physician Service Agreement? The current Physician Service Agreement is a rushed document that does nothing to address these important issues. The OMA Council, the elected council, in their wisdom, said we are in an adversarial situation, and as such, we need to have binding arbitration. This was a directive from council. It was clearly stated and clearly supported by the president. The two co-chairs of our negotiation committee put this aside. They took it upon themselves to have what I consider to be a backroom conversation with the Ministry of Health, putting aside this very important safeguard. Over the course of what we are told is 10 days, they produced a 6-page document to govern the spending of billions of our healthcare dollars. A 6-page document. My IKEA instructions are longer than 6 pages. The Negotiation Advisory Committee was informed of the resumption of negotiations, the termination of negotiations, and the production of a new PSA, all within 5 minutes. We were not involved in this process in any way, shape, or form. That safeguard was completely ignored. There was no consultation. Most importantly, this document leaves any details for solving our healthcare challenges to vague committees which will be named later. The PSA will result in an inadequate investment to cover even our most conservative estimates of population growth and patient needs. It cuts into our physician supply. I'm not sure many of you are aware of that, but the discussions revolve around the number of new physicians that will be introduced into Ontario. There's the direct talks that we have heard is that there will be a net decrease of no less than 200 physicians coming into the healthcare system. As you can remember from Bob Ray's days, this led to disastrous shortages. There'll be deep cuts to funding of more than $400 million when all added up, and there'll be, most importantly, further limits for access to patient care. In these times of budget crises and soaring debt, people will ask, where's the money going to come from? And I say, this question is the most important question. But it's not going to be answered in a 6-page document. It's going to be answered through appropriate consultation and thoughtful consultation. We need to have a functioning PSA. We need to have a more detailed physician service agreement. We need to take time with this document. This document will affect healthcare for years to come, and a 6-page pamphlet just doesn't cut it. Thank you very much.